Hey everybody, Dr. Joe from Chiro Health Spa. Today we're going to talk about what we do here for people that have disc issues that are coming from your neck. So let's talk a little bit about how the discs actually operate. So, a normal set of bones in your spine, this is the back. So if you were to rub your neck, this is actually what you're feeling. This is the front. So there's two bones and then there's a disc in between. And that disc should not be pressing on the nerve, and then that way the nerve can get all the information to wherever it's going. So in the neck, it may be the thyroid, it might be up into the eyes, the face, the head, etc. So this is a good set of bones. When we look at what happens in, let's say, a disc herniation, you could see that, think of a disc like a jelly donut. So if the jelly starts getting smushed, it comes and pops out. That's the jelly that'll sit right on that sensitive nerve. This nerve is very sensitive, so it doesn't need a lot of pressure before it gets affected. Now, it might get affected by pain, numbness, tingling. You might feel things down the arm, for example, even into the hand. So if you're feeling that stuff, that's where that disc may be laying directly on this nerve, okay? Now, if that's the case, there are things that can be done about it. Depending on the location and the severity of the problem, we actually use this therapy right here. This is Una right here, and she's laying on something called spinal decompression. And what that means is that we're literally going to open up these bones here, and we're going to take the pressure directly off of that nerve. So she's laying like this, and if you think about it, we're going to open those joints up, we're going to open those bones up, and we're going to give that nerve a lot of breathing room. Well, when there's breathing room, all of a sudden it says, wow, I feel really good, and I feel a lot happier about the fact that I don't have something pressing on me. So while she's laying here, as we're looking at this, literally all that's happening is that she's laying, and then this is going to open up and it's going to close. It's going to open and it's going to close. And when it does that repeatedly, the body starts to get a really good, happy sensation and say, I feel fantastic. And if you have had a disc problem in the past, you probably feel like, boy, if somebody would just lift my head straight off of my shoulders, I would feel so much better. And that's pretty much what this is doing. It's just doing it for a very calculated amount of pressure, and it's doing it for a calculated amount of time, so we know exactly what we need to do for your spine in particular. Now, how do we know that you need this? This is going to come from MRI results specifically. You probably already have an MRI. You probably have a report that you got from the doctor. That's what we use to determine if you're a candidate for this, okay? We don't use this on every single person that walks in with neck pain, because this is for a very specific purpose, okay? So that's where, if you have had disc problems in the past, if you know somebody that's had disc problems in the past, this is what we're using, and this is the therapy that could literally be a life changer for you, okay? So if you know people that have this, please share this video with us, with them. If you had it, we can't wait to see you, and we'll look forward to you seeing the next video as well.